Following the issue of those summons to the two KTN investigative journalists, there have been unsurprisingly sharp reactions, especially from the media fraternity, most of whom have gone ahead to write editorial comments on the same, saying that it is a sad day for the media in Kenya who are, and I quote one of them, witnessing the unacceptable return of the outdated repression of the fundamental freedoms and rights of that are integral to the industry.
Right, and just to paint a background picture of all this that is happening, there are two bills that should be coming in Parliament that have already passed the first reading, and these bills will be the Media Information and Communications of Kenya Act 2013, which basically seeks to create a body of the government, and this body, the constitution of this team, will be made and determined fully by the Cabinet Secretary of Information. Now, this body has the sole responsibility of checking the ethics in regards to what is brought out in the media. Now, what the media practitioners and stakeholders are against is that it gives the government a free hand to determine what exactly is passed on, and they're therefore calling for a rearrangement of the makeup of this particular committee. But in effect, they're calling for self-regulation that is currently being done by the Media Council of Kenya. And of course, we do expect these particular pieces of legislation to be before the floor of the House anytime now.
A conversation that we'll certainly be following in our subsequent bulletins. But right now, let's head off and see what's happening with UNICEF. And it's just a few weeks after the Kenya AIDS Indicator survey showed that Homa Bay County had the highest HIV prevalence in the country.
The leaders of the devolved unit have launched a program to battle the scourge. The program that UNICEF will fund also targets the country's runaway maternal and infant mortality rates.
KTN's Fredo Mulo has the details.
From Kindu Bay in the north to Muhuru Bay in the south, the unique lifestyle of the Luo and Suba fisherfolk here has conspired to create the worst HIV statistic that stands at 27% against a national average of 6%. This has inspired UNICEF to launch an integrated health plan that aims at stemming the tide.
A country in which we have a very solid rights-based, rights-focused constitution, there is no way we can continue to accept that children and women should die because of preventable causes. Wadagi.
The global NGO will fund the Wadagi initiative, providing crucial elements such as resources and equipment, while the county government provides the manpower, including community health workers who will provide care at the household level.
I'm happy we are finally moving away from the endless medical researches conducted over the years to a practical approach to the health issues. We are aware that we have done a lot of research in this county, and we have now got what we call empirical evidence.
Wadagi means we have refused in Luo, and in this case, residents are being urged to resist death from preventable causes.
We are going to have a community health unit strategy so that each and every community is a health unit, and each and every household is an hospital.
Several large-scale initiatives, among them being the popular male circumcision, have all failed in dealing with the HIV menace in this region. 5 decades after independence, and the residents of this region continue to suffer elementary health challenges despite the existence of a central government. Thankfully, the advent of devolution could help address most of these challenges conclusively. From Bitter Point in Homa Bay County, I am Fredo Mulo.